Good morning, everyone. I, Rhick Chakraborty, on behalf of our whole MT family, would like to wish all my seniors, friends, and juniors a happy World Radiography Day. This is a special day for us because on this day, our great German physicist, Sir Conrad Wilhelm Röntgen, took birth, and as we all know, he is the discoverer of X-ray, and X-ray is an important part of our whole professional field, and we are mainly concentrated on this X-ray based modalities. Apart from this, we are also taking equal part in MRI and other different modalities. But on this day, we would like to recall our role as a radiographer, and also as a allied health professionals. We play a very important role in this medical field because we are as important. We are the pillars of this entire health system. So as we are all aware of it, but still I would like to recall the role as well as the protective measures that we should always keep in mind for giving a better service. Now, before going to our entire deep part, first we would recall what are the role of radiographer, and most important, who are radiographers. We are named differently in different states, in different countries, mainly as medical technologist in the department of radiodiagnosis or radiographer. Now, a radiographer is a well-trained allied health professionals who has a knowledge of both the radiophysics, means how to deal with this X-ray or MRI based modalities, and equally we should have the knowledge of anatomy, physiology, and pathology, because we, in a simple word, act as a eye to the radiologist. Since the patient, as they come, first we are the one who sees the patient and detect the problem or pathology using different modalities. Maybe it may be X-ray, maybe CT scan, maybe MRI, mammography, anything. But we are the one who sees and differentiate a normal physiology or normal anatomy with the abnormal or defective part. Since we are the one who are present in these different modalities, so apart from this anatomical or medical knowledge, we should also have the knowledge of first aid and the safety measures that we should take before arrival of the medical assistance in any emergency situations. Now, let us give a brief on what are the modalities that we are concerned or we take part in. First, let's go to the basic one. We are the one who handle X-rays. It may be a portable X-ray or a manual X-ray, maybe digital one, but we are the one who handle it. We know how to handle it, how to take care of patient in an X-ray room. Apart from that, we are the one who are handling CT scan. We are the one who are doing interventional radiology, the most advanced medical imaging techniques, DEXA scan or BMD, C-arm or O-arm in orthopedic surgery as well as in cardiology departments, dental scan, etc., which uses the X-ray. Apart from that, we are also involved in MRI scan and many advanced imaging modalities. Now, let's discuss about our role in this modalities. So, when a patient comes to a hospital for treatment of any diseases, first doctor sees the patient, then advise some of the tests or diagnosis which are the one that we perform. So, first it may be a MRI, maybe CT scan, maybe X-ray. So, when a patient comes to this modalities, first our role is to see the patient history, because history is one of the important thing which will help us to know many minor things that is important during these procedures. Now, second step is to take a proper consent from the patient, because when a patient comes to our department, a patient is always mentally weak. That means they have a fear that what will take place in this modality. So, it's our responsibility to explain them with all the procedures thoroughly, so that they become comfortable with us and they will be able to perform or participate in the investigation in a very easy way. So, the third step is we have to ask the patient to change their clothing to a hospital or the clothing that will be comfortable for them to perform the examination. Then it's our duty to help the patient with some mental support, as a patient is already in trouble. So, we should always try to make the investigations or the procedure as comfortable as possible. So we can help the patient with allowing some relatives, or maybe if it is a female patient, we can allow a female staff or a female member to enter the room. But as we are mainly working in a X-ray or radiation field, so it's our duty to protect them from unwanted radiations. So as they enter, we will be providing them with different safety kits such as lead jackets or other lead accessories, so that the relatives who enter with the patient should not be exposed, and also avoid the part which are not involved in the investigation to be covered with this lead jackets, so that unwanted radiation doesn't affect the patient in any ways. As we all know that radiation have many side effects. It may be biological, it may be some other, but it has some side effects. So as a radiographer, it's your duty to reduce this exposure to a limit as low as reasonably achievable, that is ALADA. So now after this investigations, we should always see the patient conditions, because we not only X-rays, we follow different investigations which may have some side effects. So we should always see whether the patient is having some side effects. If they are having, either we can give emergency doses that we have in our X-ray rooms, or suggest the patient to go to the nearest medical assistant available. Okay, so this was about X-ray. Apart from X-ray based modalities, we also use MRI. MRI, as we know, as it is a magnetic based modality. It's mainly used to diagnose a patient where more detailed study is required based on the hydrogen or the water molecules that are present in our body, using this as a substance for MRI imaging. So when we are performing a MRI, it is very important for us to see whether the patient is having any foreign metal object, because in MRI it's very risky to carry even a small amount of metal inside the MRI room. So we should always check the patient thoroughly and remove each and every metallic substances from their body, and allow them in only when we are confirmed about the risk versus benefit. So now there are three things that we should always keep in mind as a radiographer. That is, there are three principles be forgotten as a radiographer. That is, first is time, second is distance, and third is shielding. Now time, since we as a radiation field worker, we spend most of the time in a X-ray based or MRI, but I am especially concerned about the X-ray based because it has many side effects. So we should always try to spend the minimum amount that is possible in an X-ray based source, because the time a worker or a professional spend in a X-ray based source is directly proportional to the radiation dose. Secondly, distance. So as we all know that X-ray acts, or the X-ray passes on the basis of a light, that is, from a source, when it is emitted, it diverges as a beam. So as away from a source, lesser is the dose that it gets. Now when this two principle, that is lesser time and maximum distance, is not possible, in many cases it's not possible, then we should be properly sealed it. We should always try to cover ourselves with lead seals. That may be a lead apron, maybe a gonad guard, maybe a thyroid sealed, maybe a lead spectacles, but we should always try to cover ourselves and prevent ourselves with the minimum time that we can spend, or the maximum distance that we can afford from a radiation source. Now I would not take much time. At last I would say one more point, that is, a proper maintenance of machine is very much important, as if we use, as it is a machinery, there may be a fault and we don't take care of the machinery and check it from time to time, there may be a leakage, degraded exposure quality. So we should be in a regular checking or subjected to quality assurance before use, and only the qualified radiation technologist must be allowed to handle this machineries, because we are the one who know how to handle it. And as a patient party or patient, it's very important from their side also, that as they are checking the qualification of a doctor before going to a hospital, it's very important that they should check or they should ask about the qualification of the medical technologist or radiographer who is performing the diagnosis, because a proper well-trained medical technologist or radiographer can give the proper diagnosis, and a ill-trained or some non-relevant person will never be able to give that diagnosis in a proper manner in a low radiation dose, so that patient can get the best treatment in a very reasonable radiation. That's all. Thank you and wish you all a happy World Radiography Day.